So today our conversation will cover the healthcare system, perhaps in its totality. We'll talk about healthcare funding, where NHI starts us off, the healthcare workforce, leadership and governance in this environment, potentially medicine and technologies, the infrastructure, and also our own personal roles in public sector and our own contribution. So now to kick us off, Prof. Harris, the NHI is now enacted as law. Do you want to sort of maybe give us a slight history from the first green paper to white papers and the two bills, and what you anticipate the impact of NHI might be for our healthcare system as you see it?
Yeah, so, well, there's a long history, so I'll try and condense it. And I guess what's important from the private sector side is that the pathway that we were on up until around 2008, when we were talking about a sort of social health insurance framework, and then from 2008, then there was this notion of the national health insurance, which envisaged the single fund structure. So the key proposal around the NHI is that it will be the single purchaser of a defined package of healthcare services for the whole population, and that it would create this purchaser-provider split between, there would be the fund, the NHI fund as the purchaser of those services, and then the providers would be both public and private sector providers. But the key thing that distinguishes it from other health systems globally is this notion of being the single fund.
Sure.
Mm-hmm. So the medical schemes, for example, would be precluded from being able to offer those services.
Sure.
And that means that the whole population will be dependent on tax funding to provide that set of services, which constrains what can be provided.
Sure.
And I think that's where, and then perhaps maybe just to kick things off in terms of the discussion, I mean, I think that's where the differentiation of views arises. And I think certainly from the medical scheme industry side, it's not a case of saying that the NHI fund doesn't have a role to play.
Yeah.
But unfortunately, we do not have the means to say, well, we can have a comprehensive package of services funded entirely by tax funding, by public revenue.
Yeah.
And so we need to structure a more integrated approach
Sure.
to bringing as much funding as we can into the healthcare sector,
Yeah.
so that we can deliver more and better healthcare to more people. And then maybe just, as a last point, and I hope that's a higher level enough summary, but it's also not just about funding.
Okay.
And, we've had a lot of debates around funding and financing, but actually and this is coming from the actuary here, but what makes the health system work is particularly our healthcare professional resources.
Sure.
And I guess, that I would characterize as my biggest concern at the moment is the level of uncertainty is causing a huge amount of anxiety amongst our healthcare professionals, and they are a really, really valuable resource that we need to protect and nurture. So, I think, we are actually aligned in wanting to do that. And I think it is a case of us working with to find a model that brings in the principles that the NHI policy framework is built on, but perhaps is more feasible given our resources as a country in terms of rolling out healthcare effectively to more people in South Africa.